Welcome to Physician Focus. I'm Dr. Bruce Carlin. Most of us think of a visit to the dentist as separate and unrelated to a visit to our physician. But that kind of thinking is changing. Evidence has shown that oral health and physical health are indeed linked, and that problems with our oral health are associated with problems with our physical health, such as respiratory disease, cardiovascular disease, and diabetes. The U.S. Surgeon General, in fact, issued his first ever report on oral health in America more than 10 years ago and declared that oral diseases remain prevalent across the country and that for some populations, the lack of oral health was a silent epidemic. This edition of our program will examine the state of oral health today, the connections between oral and physical health, and how physicians and dentists might work together for the benefit of patients. Our guests for this discussion are Dr. Hugh Silk and Dr. Michael Wasserman. Dr. Silk is a board-certified family medicine practitioner and a clinical associate professor in the Department of Family Medicine and Community Health at the University of Massachusetts Medical School. He is also the chair of the Massachusetts Medical Society's Committee on Oral Health. Dr. Wasserman is a general dentist practicing in Pittsfield, Massachusetts, and a member of the Medical Society's Committee on Oral Health. He is the president of the Massachusetts Dental Society, a 5,000-member professional association and a constituent of the American Dental Association. Welcome to you both.
Thank you.
Yeah, thanks for having us.
Well, this is a wonderful program. Why don't we start with the basics? What is oral health? Michael?
Well, oral health is the health that relates to the general conditions of the mouth and the teeth, and I would say going back into the throat and some of the areas outside or around the mouth, the perioral areas, I would say.
And does this have wider implications, as we were saying in the introduction? Hugh, you've been at this for 15 years, getting the Medical Society interested in oral health as an important part of our overall health.
Yeah, Bruce, I think sometimes people think of this as just dental health and they think of just the teeth, but you're really talking about, the gums have disease, the tongue can get cancer, the lips can get cancer or cold sores. But beyond that, if you think about the last time you had pain in your mouth, it's just hard to function during the day. Or if you're going for a job and someone's looking at your mouth, if you have, a nice smile and that kind of thing, it makes a difference.
And just getting into the other problems, what happens from oral neglect or oral diseases in general?
Well, basically caries, the most prevalent disease that we know of. Gum disease, gingivitis, as people may call it. Some people may hear about periodontitis, which is a more advanced form of gingivitis.
So each of these are structures around the teeth and gums. Yeah. So periodontics.
Periodontics refers basically to the structures around the tooth that help hold the tooth into the mouth. That includes the gums or the gingiva. And the initial stages of gingivitis basically just means an inflammation of the gingiva, of the gums, where it may then advance into an inflammation of the structures, the bone, and other structures, and we call that periodontitis.
And to pick up from that, it starts in the mouth, but what we're learning now is that inflammation that's around the teeth starts to drift off into the body, and then the rest of the body starts to create even more inflammation. And we now know that diseases like heart disease or strokes is all about inflammation. That's why people take an aspirin a day. That's why they end up taking cholesterol-lowering medications. And so what starts off as a mouth problem becomes a full body problem.
So the mouth is basically one of the barriers to inflammation getting into the rest of your body, and if you've broken down that barrier, all of a sudden you're introducing disease to the rest of the body.
Yes. Sometimes we notice that some of the diseases in the body cause problems in the mouth, and vice versa. Some of the problems in the mouth can cause diseases in the body. Some of our diabetic patients may have increased inflammation in the mouth, yet if they don't take care of themselves, the inflammation in the mouth increases, and then that relates back to how their diabetes is being controlled.
In fact, dentists were the first subspecialty of medicine. We used to all be doctors, and then the dentist broke off early on, saying that the mouth was a separate form of, or a separate area for focus, and required specialization, so that the continuum is really artificial. It's really, is that what you're saying?
I mean, the relationship is becoming much closer and getting much better. I think for many years there was kind of a divide where physicians did their thing and dentists did their thing, but now we're discovering the true relationship of what goes on in the mouth and what goes on in the body, and dentists and physicians are starting to work much more closely together.
So are there groups that are at special risk, that are particularly vulnerable?
Yeah, I mean, the ones that I think get the most discussion nowadays, if you take very young children, so children start to have teeth at 6 months of age, and often, by no fault of their own, parents or physicians or sometimes even dentists aren't focused on those, initial teeth. And suddenly the child's 1-year-old or 2-year-old, and now everyone's coming together around it. People with special needs, someone with cerebral palsy or Down syndrome, again, you get so focused on the heart effects or the or just getting to an appointment.
Other aspects of the disease.
Yeah, and then that third group that I think is getting more attention right now are prenatal women. Again, only a third of women when they're pregnant go to see the dentist, and even if they have a problem, only 50% go. Some of that has to do with, a well-meaning mother-in-law saying, I lost a tooth when I was pregnant, you don't go. Or for the longest time, we didn't have guidelines telling dentists and physicians what was safe in pregnancy, and now we do. So those are certainly some of the groups. I would add the elderly. 70% of our elderly do not have dental insurance. Medicare doesn't cover dental. So again, what is the person to do?
And do you see special vulnerable populations in your practice, Michael?
Well, I do. I see, number one, I see the poor. I have part of my practice is people that are on Mass Health or the Medicaid program in Massachusetts. I see young children going across all economic strata, and as Hugh said, I see the elderly. And they each have their own unique problems and their own unique situations, and we have to deal with them differently in their treatment planning.
Are there barriers to care?
There are barriers to care. There are barriers to care. There are barriers to care there are economic barriers to care. There are cultural barriers to care. There are maybe even social barriers to care. It's a multifactorial problem that is not very easily dealt with. It's not just someone not being able to get into the office. It's quite often someone wanting to get into the office, or someone starting there.
Where they don't even want to get into the
Sure.
office, or they're
Sure.
afraid.
Well,
we
fear,
certainly have some.
Fear is a very big factor.
Right.
Fear is a very big factor. Some people just have never been taught the importance of going to the dentist and the importance of basic oral health and basic oral care.
Yeah, I mean, if you look at 50% of the children in Massachusetts who have insurance, have Mass Health, don't get seen by a dentist. I mean, there's transportation issues. There are in the rural parts of the state, there are just fewer dentists who are available. People have very busy lives, working 2 and 3 jobs. So there's all sorts of things that get in the way of getting that care.
But from the sounds of it, the poor population is getting covered to some extent. And
well, they are getting covered to
some of them.
They are getting covered to some extent. Massachusetts, for the past number of years, has really only covered what we call preventive services. They've covered cleanings, x-rays, extractions, maybe an emergency visit. Rather recently, they started covering fillings again. It's our hope at the Dental Society that we can see full benefits restored to these patients, because we'd rather not have them lose their teeth. We'd rather have them keep their teeth.
It's easier to treat it early That old thing, you can pay me now or you can
Right.
pay me later.
That's right.
Later costs a lot more.
That's
Yeah,
right.
And again, people, when in the absence of good dental coverage, I mean, people end up in the emergency room. We're seeing 2% of all visits now to the emergency room are for oral health reasons, to physicians who can't do a whole lot for a person. Maybe some antibiotics, some pain medications, and then they need to get to the dentist. It's money poorly spent. When we come together and work on programs, I mean, I have to give the legislation credit. There's an oral health caucus in Massachusetts, which is unique, where members of the House and members of the Senate came together to pass laws to improve mass health benefits for citizens. Representative Syback, Senator Chandler, these are folks who saw the importance of making sure more people have coverage.
So let's talk about the collaboration, because the two of you were in the Mass Medical Society's Committee on Oral Health, which is wonderful. Can you? What was the impetus behind the collaboration? What and where are we going with this?
Well, I came onto the task force in an advisory position, though I am a full member of the task force. And I did it upon the invitation of Dr. Silk and the Massachusetts Medical Society. At the Massachusetts Dental Society, we have a program called Connect the Dots, which is strengthening the relationship between physicians and dentists. We also have other programs, which we can get into, about age 1, seeing children at a young age. But this whole task force works for us because it allows us to grow in terms of our relationship with physicians and in the connection of the oral health to the health of the body.
And I think on the flip side, the Mass Dental Society had reached out to me years ago to be part of a committee on access prevention and interprofessional relations. And so having dentists serve on doctors' committees and vice versa, it's what needs to happen. We said at the outset of the show that if the mouth is affecting heart attacks, if the mouth is affecting uncontrolled diabetes, then of course we want to educate physicians to know more about that. So when you go for your diabetes appointment, they check your feet, they check your eyes, your sugar, and they say, hey, have you been to the dentist? You need to take care of your gums.
I've got to admit that I don't always say that. it's a fact, but maybe we should be, because we use these other end organs, if you will, as the sort of the canary in the mine to tell you that there's something else going wrong. And you're saying right here, for our viewing public, that the mouth can also likewise be a canary in the mine, and that an oral exam, at least a cursory one in the physician's office, can occasion a visit to the dentist.
Yeah, and Michael and I have talked about at the committee, how are we going to educate the next group of health professionals? And there's a lot of interprofessional education going on at some of the schools in Massachusetts and beyond. If we can teach nurses, physician assistants, dental students, et cetera, that the mouth is important, and then they can sit around a table and go through cases and think about how they can work together, the next generation, it'll just be common sense to address the mouth at every visit.
It'll be natural.
Yeah.
So let's talk about some of the things that you're doing. You've got Connect the Dots. You've got what other community resources are you involved in, and how are we doing this education, this outreach to the physicians?
Yeah.
And to the population.
Yeah, I think one of the ones that we're focusing on right now, Mass Health and Medicaid across the country has now seen that because children come to see physicians when they're very young, before they've established dental care or while they're establishing dental care, that we need physicians to start to give the same good advice they give about car seats and other important health tips. So through DentaQuest, which is a nonprofit foundation, we have money to go into physicians' offices and train them to look in the mouth, to give good advice about diet, about fluoride, about brushing, about getting to the dentist, and to apply fluoride varnish, which is a thin layer of varnish that goes on the teeth. It stays on for somewhere between 1 to 7 days, but the benefits last for about 6 months. So it's a direct thing that physicians can do while they're trying to get the child in to see the dentist.
you bring up fluoride. We've had various issues where the medical society has absolutely nothing bad to say about fluoride other than you should use it. And we have some communities that still don't, are reluctant to put it on board. Do you have comments about that?
Well, I'd say that fluoridation is probably one of the best public health efforts that ever came about in this country. The issue with fluoride is that these are local political issues, and there's a lot of misinformation out there about the effects of fluoride. All the good science shows that there are no ill effects of fluoride, especially when it's placed into the public water systems, because it's done very carefully. You know, there are specific amounts, there's formulas that are followed, and it has been shown over the years, since about the late 1950s when it was first introduced into the water, that it really works. The issue in Massachusetts is that there are large areas of this state that are not fluoridated. And it's a local political issue that is sometimes very hard to overcome.
And it's money well spent. For every dollar you spend on water fluoridation, fluoride in the water, you save $38 in the after effects. So I think we know that it's money well spent. I think we know that it's safe. The folks that bring up arguments against that, I personally have looked at those studies. There was a study looking at IQ, for example. Well, as we said a minute ago, we're talking here you get 0.7 parts per million. That's a tiny, tiny amount in your water. In studies where they've shown effect, those were 70, 80 parts per million. In some cases, mice were fed nothing but fluoride. So the way it's monitored in places like Massachusetts and across the U.S., there is nothing but benefit.
Yeah. There are areas of the country where they have very high levels of fluoridation naturally in the water. Now, those areas may not be fluoridated. In certain states, I think South Carolina, Colorado, they don't need it. But in Massachusetts, it's certainly needed, and there's certainly not enough. And what happens is we tend to use a lot more supplements. We use daily supplements in a pill form.
And
we have varnish. We also have programs in the schools, swish programs in the schools that they're called, for the children. And you have to find a careful balance so you don't have too much fluoride in your diet.
What other things should we be doing to motivate our patients on getting their dental checkups, taking care of the caries teeth, being more proactive in this, that it really is something that's going to be for their general benefit?
Well, I think it's an educational process that has to start very young. The Massachusetts Dental Society has started with the Mass Medical Society an Age 1 program where we are encouraging parents to bring their children in within 6 months of the eruption of their first tooth, which usually occurs about 6 months of age or by age 1, just to come to the office. A lot of times it's more of an educational process for the parents rather than so much checking out the children because they may have 1 or 2 teeth, but it gets the child comfortable with what's going on in the office. If you do it enough, they're used to coming in. Plus, it's been shown that if they start young, the caries level drops tremendously because you educate the parents. You get the parents involved in the whole process and taking care of the children's teeth. You talk about diet, you talk about sugar, you talk about use of the bottle and what you place in the bottle, and not putting the child to bed with the bottle, which is something that still happens in this state quite a bit. So it's very important to start very young.
Yeah, and I agree with that sort of motivational interviewing almost. So if you have someone with diabetes and you talk to them about, would you like to get off one of your medications or not add insulin? Let's deal with your mouth. You have a prenatal patient who is just focused on wanting to have the best for their child. Now is the time to take care of your mouth so that you don't pass the cavities on to the baby when they come. So I think there's certain key points in life where we can really, push this message. And Michael's absolutely right. Starting at a very young age is important.
One thing we haven't touched on in terms of oral health, what about oral cancers? What things should we be telling people to help prevent oral cancers and
Well,
how to search for them?
The best way to prevent oral cancer, number one, is to stop smoking, because it's very highly related to smoking. There's also some relation to alcohol usage. As Hugh told me, it's the 9th leading cause of death in America. Every time you go to the dentist now, every 6 months, you should be having an oral cancer screening, which is just basically a check of your tongue, of your lips, of your cheeks. The dentist should be looking at that and just taking a look and seeing what's going on, if there are any lumps or bumps that he or she might find, and to get attention to them very early on.
And I think, we're seeing less of chewing tobacco and things like that, but there's these new products coming out that, they come in a little package and you put it into your mouth and it comes in different flavors and things like that. And we don't even know what role that's going to have. But any tobacco that's going into the body is going to have systemic effects. So I think we really have to look at our teenagers and try to, get the focus away from, smoking or tobacco products of any sort.
Have to talk to our ball players too.
That's right. That's right.
I never understood that. To me, it's
dirty habit.
It's such an awful habit. I can't imagine wanting to do it, but to each his own. So, do you have in your collaboration? Is there some focus on this? Do you have motivational things set up at the Medical Society and the Committee on Oral Health about oral cancer as well?
Yeah, it's interesting. We're going to pick a topic a year. This year we're focusing on emergency rooms and trying to keep people, getting them to the dentist rather than going to the emergency room. Prenatal oral health is on our list of topics, and oral cancers is on our list of topics. So I think we're going to put even more energies into that over the next couple of years.
What is the prevalence in Massachusetts, do you know?
I don't, but it is the 9th leading cause of cancer, and it equates to 2.5% of all cancers. So, I mean, it's still
sizable.
I think I read the other day, there's 270,000 people in the U.S. right now living with some level of oral cancer. I mean, that's a lot of people.
It's very important that it be caught very early, because even if you survive the cancer, it can be very disfiguring. And that is something we really want to avoid. It could cause loss of teeth, loss of part of your jaw, loss of part of your tongue, depending on the cancer.
And again, the connection with the rest of your body, you lose some of that integrity, right. And all of a sudden you're aspirating and you're getting pneumonias, and so it's really important to keep the integrity of your mouth.
You're not able to chew. Yeah. You're not able to have proper nutrition.
Proper nutrition. And studies are showing that when that nicotine gets into the body, there's higher rates of heart disease, higher rates of pancreatic cancer. I mean, so it's much more systemic.
So again, the mouth is the harbinger of a lot of the systemic diseases.
Right.
And you as a dentist and you as a family practitioner are working together to make sure that everybody is aware of this connection, and you're bringing this to light and maybe making it part of our routine. Have you had any other initiatives that you are doing with the two groups working together, or is this the thrust of everything?
This is the thrust of everything. Now, this is just a beginning. I like to see it as just the beginning. And hopefully, through this, we'll work on a lot more issues, because I think we're seeing that everything is related. The mouth is related to the body is related to the mouth. And I think it's the start of a great thing.
We have just a few more minutes here, so I'm really interested if you have a message of importance to the viewing public about what things that they should be taking care of about mouth care and frequency of visits, perhaps.
Yeah, if we haven't made it clear, I mean, the basics are the most important. So brushing your teeth twice a day, for starting soon as teeth erupt, and up until age 3, the American Dental Association would say just a smear of toothpaste, and then you could start to add more. As children get older, adding flossing as the teeth start to touch. Getting to the dentist twice a year is obviously important. Fluoride varnish in your doctor's office or your dentist's office. As you get older, sealants are little sort of a coating that go on the teeth that protect the molars. Mouth guards, you know, these very simple things that I think if
Mouth guards in sports and
if people do those things, they'll have a lifetime of you know, good smiles and good oral health.
I think it's
Michael, you wanna add
I
to
think
that?
it's important to understand that a lot of dental disease is completely preventable, and preventable in an easy way. Brushing twice a day, flossing, as Hugh said, lowering your sugar intake, watching your diet, lowering highly acidic drinks, or have a problem now with the energy drinks and the power drinks. It's a totally preventable disease.
Well, thank you both. This has been wonderful.
Thank you.
For more information about oral health, visit the websites listed at the end of our show. And to view past Physician Focus programs, visit our website at physicianfocus.org. I'm Dr. Bruce Carlin. Thanks for watching.
I'm Dr. Hugh Silk, family physician.
I'm Dr. Michael Wasserman, dentist.
If you're wondering why a physician and dentist are sitting here together, it's because we have a message about a subject that affects all of our patients. The subject is oral health.
Your mouth is your gateway to your body, and it's important that everyone, from children to adults to senior citizens, think about their oral health as much as their physical health.
Oral health and overall physical health are connected. Research has shown that infections in the mouth are associated with serious medical conditions such as heart disease, stroke, diabetes, and pneumonia.
Dental problems like cavities, plaque, and gum disease can be prevented. So we urge you to develop good oral health habits. Brush and floss your teeth daily and see a dentist for a checkup at least twice a year.
For more information on oral health, visit mouthhealthy.org.
I'm Dr. Tom Treadwell. 30 years ago, the Centers for Disease Control described a rare, unidentified disease affecting the body's immune system. It was the first reporting of what would later be called AIDS. Today, HIV and AIDS remain leading causes of death and illness in the United States. More than 1.1 million people now live with HIV, and more than 15,000 die from AIDS each year. Those most at risk are gay and bisexual men and injection drug users. But heterosexuals are also at risk. And every year, 50,000 new infections occur, and many don't know they're infected. Health officials recommend routine screening for all patients after notification in an effort to foster early detection, and annual testing is recommended for all patients at high risk. Talk with your primary care provider about the importance of HIV screening. The conversation could save a life. For more information, visit AIDS.gov.